Welcome to The Explainer. Today, we're getting to the root of a topic that is, no exaggeration, changing the very foundation of dentistry. We're talking about the deep, profound link between what happens in the mouth and the health of the entire body. Let's jump right in.
Now, everything we're going to talk about today is grounded in some serious science. It comes from a big review article in the International Journal of Cardiology, Congenital Heart Disease, put together by folks from top-tier places like UCL Eastman Dental Institute and Imperial College London. So yeah, this is solid evidence-based stuff.
All right, let's start with a question that might make you pause. Think about your perio probe. We all see it as a tool for diagnosing gum disease, right? But what if it's more than that? What if that simple instrument could give you clues about your patient's risk for a heart attack or about their struggle with diabetes? This is the huge paradigm shift we're exploring today. To really get this, we have to kind of rewire how we think about periodontitis. It's not just some localized infection, a problem with plaque and pockets. The research is clear. This is a chronic inflammatory disease. And that's not just playing with words. That reframing is absolutely critical because it means the fire that starts in the mouth, well, it doesn't stay in the mouth. So, how exactly does a problem in the gums become a problem for the whole body? Let's trace the path. We're going to break down how that local inflammation can literally escape and cause trouble system-wide. It all kicks off with something we see every single day in the chair: plaque, biofilm. That's step one. But then, the body's immune system goes on the attack, releasing these things called cytokines, like TNF-alpha and interleukin-1, which, unfortunately, start breaking down our own tissue. And that leads to the final, crucial step. The floodgates open. The bacteria and all those inflammatory signals get dumped right into the bloodstream. This can happen even from just chewing. And here's the kicker. Once that stuff is circulating, we can actually measure it systemically. We see higher levels of C-reactive protein, CRP, and interleukin-6. And guess what? Those are the exact same markers that physicians look at to gauge inflammation for things like heart disease. It's the proof right there, showing how the mouth is directly fueling the body's total inflammatory burden. Okay, so let's zoom in on two of the biggest connections here: cardiovascular disease and diabetes. This is really where the rubber meets the road, and the clinical implications for every single practice just become impossible to ignore. And look, this isn't just some vague theory about inflammation. We've got direct evidence. I'm talking about studies finding the actual DNA of specific oral bacteria, like the infamous Porphyromonas gingivalis, lodged right inside the atherosclerotic plaques that clog arteries and cause heart attacks. It's literally like finding the criminal's fingerprints at the scene of the crime. Now, the link with diabetes, that's a whole other level. The article calls it a two-way street, and it's a really nasty one. On one hand, the high blood sugar in diabetic patients creates this perfect 5-star resort for periodontal bugs to thrive. But then it goes the other way. The chronic inflammation from the perio itself messes with the body's insulin, making it way harder for patients to control their blood sugar. Each disease just pours gasoline on the other's fire. So, the million-dollar question: does treating the gums actually help? Oh, you bet it does. Clinical trials have shown that when you provide effective periodontal therapy, you can lower a diabetic patient's HbA1c levels by an average of 0.4%. Now, that number might not sound huge, but in the world of diabetes management, that is a big deal. It's often as effective as adding a second medication to their regimen. That's a powerful impact we can have. And this story doesn't end there, not even close. The research is uncovering some really startling connections between oral health and other major conditions like rheumatoid arthritis and even cognitive decline. With rheumatoid arthritis, or RA, it's all about a shared pathway of destruction. You see those same pro-inflammatory cytokines we talked about before, TNF-alpha and IL-6? Well, the very same ones that destroy the tissues holding teeth in place are the exact same villains that attack and destroy joint tissues in RA. It's the same fire, just burning in a different part of the house. But it gets even more specific and, frankly, a little wild. That keystone pathogen, P. gingivalis, has this unique, sinister talent. It can trigger a process called citrullination, which basically alters our own proteins. Once that happens, our immune system sees these altered proteins as foreign invaders and starts creating antibodies against them. And those antibodies are a key hallmark of RA. So a bug in your patient's mouth could be directly kicking off the autoimmune cascade that leads to RA. And then there's this. This might be the most shocking connection of all: the link between the mouth and the brain. A landmark study from 2019 dropped this bombshell. They found Porphyromonas gingivalis and its toxic junk in the brains of deceased Alzheimer's patients. The theory is that these oral pathogens can actually cross the blood-brain barrier and directly contribute to the neuroinflammation at the heart of Alzheimer's disease. Just let that sink in for a second.
Okay, so we've established these powerful biological links. Now what? What does this all mean when you zoom out and look at the bigger picture? Let's talk about the incredible cost of what happens when we ignore the mouth. The numbers here are just jaw-dropping. The estimated global economic hit from oral diseases is around $544 billion a year. And that's not just the cost of dental work. Nope. That number reflects the huge downstream costs of managing all these other diseases, like heart disease, like diabetes, that are getting made worse by poor oral health. And we have to be honest, this burden is not shared equally. The article really hammers this point home. Things like smoking, poverty, poor diet, and just not being able to get to a dentist, all of these make periodontitis worse. This turns oral health into a major issue of health equity. It's our most vulnerable populations who are carrying the heaviest load, not just in their mouths, but in their overall health. Which brings us to the final and I think the most important part of all this. How do we turn all this incredible knowledge into action? What is our role as dental professionals in this new world of integrated healthcare?
So here it is. This is our new standard of care, our action plan. It means we have to be actively screening our patients with chronic diseases for periodontitis. It means we need to build real relationships with physicians, making referrals a two-way street. It means empowering our whole team to spot the signs. And of course, it means educating our patients over and over again that caring for their gums is essential for their heart, their blood sugar, their joints, their life. We have to be the champions of prevention, not just for teeth, but for the whole person.
So I'll leave you with this one last thought to chew on. The evidence couldn't be clearer. The mouth is not Las Vegas. What happens in the mouth does not stay in the mouth. As clinicians, this research is a direct challenge to us to expand our vision of what we do every day. So the question isn't just, how do I save this tooth? It's, how does the care I provide today improve this person's entire health and their quality of life? The next time you pick up that probe, just remember, you might be doing a lot more than just measuring a pocket. You might just be saving a life.